My name's Janine Graham. I'm an operating department practitioner and I work in the Women's Hospital at Doncaster Royal Infirmary. Qualified in 1997 and worked at Doncaster Royal Infirmary for quite some time. My husband was in a similar profession and we ended up with two beautiful daughters, but unfortunately due to on-calls, weekends, nights, commitments, we both couldn't carry on our career. So I didn't leave because I didn't enjoy the job. It was just the situation at the time. Now my children are grown up, so I thought it's time for me, time to come back and do the career that I really enjoyed. The process was quite easy. I got in touch with Kim, who's in charge of education, and it was pretty straightforward. She dealt with the paperwork to get me back, my foot back in the door, and it all happened pretty quickly. I feel as though I had lots of support from members of staff that were here within the Women's Hospital and main theatres. I worked supernumerary, obviously, to get my experience and my hours in. And the professional people that I did work with were very supportive. I had 15 years out of the career and I was extremely nervous when I came back. I just thought everything would be completely different, but it's not. The patients still come through the door, the anaesthetic's the same, just a few bits of different equipment and different protocols and procedures, but I soon picked it all back up and it was like riding a bike, so don't be scared.
I am Penny Rodgers. I work for Doncaster and Bassett-Law NHS Trust as a theatre manager in the Women's Hospital. We were approached by the education team within the trust. They're saying that they've got a return to practice ODP who was considering coming back, and we thought about it, and why wouldn't we? Because they've got a wealth of knowledge and it would be fantastic for the trust, and it would also help with our vacancy situation. They've already trained, they've worked within healthcare. They've taken a break for whatever personal reasons they wanted to take a break. So they're bringing that training and that knowledge of healthcare back into our department. So it's fantastic. We've supported her through a programme. We've given her a programme of learning to do. She's gone through all our theatre departments. She's learned all the skills of new equipment, of new processes, and then she's settled within the women's theatres. I would say to other organisations, definitely, it's a fantastic route to get these people back into the healthcare setting, into the NHS, to be able to fill our vacancies.